Hello, my name is Monica Kirsch, and today I'll be talking about anatomy and physiology differences, the anatomical position, anatomical directional terms, and anatomical regions of the body. The differences between anatomy and physiology, or the anatomy is the study of the structures of the body. So anywhere from a structure of a tiny cell to the structure of the entire body. Physiology is the study of the function of the body. So again, anywhere from the function of a tiny cell to the function of the entire body. The importance of using proper scientific terms when working in clinical practice is to avoid misunderstandings and confusions. So similar to giving someone driving directions to the hospital, you wouldn't want to say turn at the big tree on the corner. You'd want to say head north on a specific road and make a right on that specific street name to get to the hospital. So when working in the medical field, you want to be able to use proper terminology to describe where injuries are and where parts of the body are on your patient. So first we have the anatomical position, which is a specific stance. And to show you that, I will use this doll. She's going to be upright with her feet a little bit apart, flat like that. Her face forward, head face forward. Then she has her arms with her palms up a little bit to the side of her body. So she's not going to stay like that, but that's the proper anatomical position. Then we have some directional terms that help us when referring to this position. So we have superior and we have inferior. So superior is anything closest to the head, and inferior would be further away from the head. So as you see, her feet are inferior to her chest, and her head is superior to her hips. We also have anterior and posterior. Posterior means it's closest to the back. Anterior means it's closer to the front. We also have imaginary, if you will, if you cut her body in half, this would be referred to as the midline here, separating the left from the right. Anything close to that midline, we would refer to as being medial. And anything further away, just like her arm, would be lateral from the midline. So we also have proximal and distal. So if we use her limb, which is mainly for limbs because you're talking about it being proximal, meaning it's closest to the origination of the body from the body. So her shoulder is proximal here to her body, and then distal is further away. So her fingers would be distal from her elbow, let's say. Then we also have superficial and deep. So if she has a superficial wound or cut, that means it's closer to the surface of the skin. If it's deep, that means it's deeper inside, like an organ or anything inside the body further away from the skin. So those are the anatomical directional terms. Now I'm going to grab my pen and show you the anatomical regions of the body, starting with the axial region, which is the head, neck, and trunk area. So the cephalic region is her head, cranial region is her skull, frontal region is here, optic region, her eyes, nasal region, oral region, mental region, buccal region, otic region. Then at the back we have the cervical region here. I'll continue with the back, the dorsal region. We have the vertebral, the lumbar region, the sacral region, gluteal region, and then going back to the front, the thoracic region, which goes down through her abdominal area. We have the axillary region, which is like her armpit, mammary region, sternal region, abdominal region, and then here, if you will, imagine her belly button, maybe about right here, her umbilical region. Pelvic region is between the hip bones here. Inguinal region is just under that. Pubic region, and then perineal region down here. And that sums up the axial region. So now we're going to move to the appendicular region, which is basically her arms and her legs. So starting with her arm, we have the acromial region, which is the shoulder area, brachial region, and then we have the antebrachial region here. Then we have the inside of the elbow area right like right around here. It's the antecubital region, and the back of the elbow, the olecranon region. It's kind of like your elbow bone here, and then the antebrachial. Then we have the carpal region here, and the metacarpal here. Then her hand is referred to as manual region. Digital region is her fingers. Pollux region is her thumb. And then palmar region is the palm of her hand. And then moving down to her leg, we have the coxal region, which is her hip. The femoral region here. Then her knee, the patella region. And the crural and sural region, front and back of the body. And then the back of the knee, for some reason the hardest one for me to remember, the popliteal region. And then we have down to the ankle area, which is the tarsal region, metatarsal. Then we have the pedal region, which is her foot. Digital region, again, the fingers and the toes. Hallux region is the big toe. Plantar region is her foot. Then we have the area where you get calluses, the calcaneal region here. And that sums up the appendicular region of the body. So today we have discussed the differences between anatomy and physiology, and the anatomical position, anatomical directional terms, and the anatomical regions of the body. So thank you so much for watching and listening. Goodbye.